Hi, I'm Emily Kirchner. I'm a fourth-year medical student, and I'm with Students for a National Health Program. This year, we're hosting the second annual Medicare for All National Student Day of Action on Halloween, October 31st. Our theme this year is Treat, Not Trick, asking people to remember that private health insurance is a trick, and we're just trying to treat our patients. And today, what I'm going to help you do is create your Halloween look for your Halloween costume that you're going to be wearing at the Treat Not Trick rally you're attending. Okay, so the first thing that we're going to do is wash our face. I've actually already done that, and this is so you have a clean and transparent beginning to the makeup process and also the health insurance reform process. Make sure you bring big pharma and health insurance lobbyists and advocates to the table, but push out any advocates for single payer, which, as we know, is the only way to have affordable, quality healthcare for everyone. And we're going to begin with some primer. This is a foundation primer, and you're just gonna put a little bit on your fingers and then you're gonna rub it into your face. And I really wanna make sure you push it in there because this is to symbolize how health insurance companies push the costs onto their clients who have to struggle with high copays, high premiums, high deductibles. So the next thing that I do is I put on concealer, and my concealer is called Light number 29, and 29 is for the 29 million people that were uninsured in 2015 despite the passage of the Affordable Care Act. We use powder foundation, and this shade is actually called Profits Over Patience, and I'm using a brush. It's about medium softness, medium size, and this is to really symbolize how we're screwing over the middle class and the working class. You just want to put it all over your face. We're using a black eyeliner shade, of course, and you're just gonna line your eye. You're gonna line the other eye. Perfect. And of course this tip, I'm not sure if you saw, it has a blunt tip, and this is to represent the blunt object I always want to stab myself in the neck with on patient rounds when I learn that yet another patient has an issue with their insurance and they won't be able to pay for their stay or pay for the medicines they need or pay for the treatments they need after they leave the hospital. Mascara, of course, is part of our makeup process, and what I hear from a lot of people is they're worried about too much mascara coverage and having it look gloopy, but you don't need to worry about that because remember, what we're talking about is health insurance, and the new thing is underinsurance. So really a lot of people are underinsured, which means that they pay so much for their healthcare that it's over 5% or 10% of their family's income, and they can't use it because it's too expensive. So don't worry about too much coverage. Underinsurance is the new thing. The last thing we need to do is a lip color, and I am choosing a bright red right here because this represents being in the red and represents medical bankruptcy. Of course, that's the leading cause of bankruptcy in our country, and actually a full 3/4 of the people who have to claim medical bankruptcy were privately insured at the beginning of their illness. Perfect. We'd like you to think about what's really scary this Halloween. Students for a National Health Program thinks it's the fact that about 30,000 people die every year because they're uninsured or underinsured. We think this is unacceptable, and we'd like to do something about it. If you agree, join us on Halloween. Go to student.pnhp.org and find an action near you.